Hello and welcome to another episode of Save Your Money, Save Your Teeth. I'm Ion, and today we're discussing a topic that often goes ignored until it's a painful emergency: men's oral health. Dr. Yudelman from OPTISMILE is back to explain why this silent crisis is about much more than just a bright smile. It's about your heart health, your stress, and long-term vitality. Dr. Yudelman, welcome back.
Thank you. Thanks for having me back. And yeah, we've got a great one today for any men listening to this, or if you are a mom or a wife, this is for the men in your life. Share it with them.
So, Doctor, statistics show that men visit the dentist less than women. Why is this such a major health risk? Are the guys scared?
Actually, yes, I think they are.
Really? Hey?
They also, a lot of them are like very busy, too busy to look after themselves in general. And men on average attend the dentist less frequently and only when something hurts. We often will see mom, and then she brings the kids, and then 2 years later she calls up, or the PA calls up and says, Mr. Jones has got a toothache. Can you get him in? He's off to London tomorrow. We only got, they're very, very short on time, even when they do get a toothache. And the pattern is risky because most serious oral diseases are silent in the early stages. Gum disease, tooth cracks, even oral cancer can progress significantly before pain appears. And there's large population studies that consistently show that men have worse periodontal health and higher rates of advanced gum disease when they get diagnosed, and also higher rates of tooth loss compared to women, which is interesting. And not only because the men's teeth get weaker, it's because disease is being detected later when treatment is more complex, more invasive, and more expensive. And, from a preventative perspective, regular dental visits are not about fixing problems. They are about identifying risk early, monitoring changes over time, and intervening conservatively before damage becomes permanent. When men delay care, they miss that window. The save your money message is simple. Early detection is cheaper, faster, and far less disruptive than emergency treatment. And the save your teeth message is even clearer. You cannot preserve what you do not monitor.
That's very true. Very, very true. Doctor, you often hear about people saying that bad gum health and just bad teeth in general, that it's linked to heart disease in men. Is there a documented link between gum disease and heart attacks, especially in men over 40?
Yeah, there's a very strong and well-documented association. They're not calling it causative, but they're very strong associations, and hundreds, if not thousands of studies by now between periodontal disease and cardiovascular disease. I mean, some of them even in the last 12 months, while gum disease at this point, they don't think directly causes heart attacks. They both share common inflammatory pathways. So chronic gum infections lead to persistent systemic inflammation, and there's inflammatory markers in your blood called C-reactive protein, and they're elevated in people with advanced gum disease. And inflammation plays a central role in atherosclerosis, which try saying that after a few drinks. Atherosclerosis. So atherosclerosis is the thickening of your arteries that causes strokes and heart attacks. Multiple large observational studies and meta-analyses show that people with periodontitis or gum disease have got a higher risk of cardiovascular events like strokes and heart attacks compared to those with healthy gums. So treating gum disease has also been shown to reduce the general inflammation in the body. And so for men over 40 who already have a higher baseline risk, ignoring gum health is not a neutral choice. Oral health is part of your whole body health, and the mouth should not be viewed in isolation from the rest of the vascular system. What happens in your mouth is not Vegas. What happens in your mouth doesn't stay in your mouth. What happens in Vegas stays in Vegas. Yeah. In case someone hasn't heard that expression.
Yeah. No, I get it. Yeah. Okay, that's a good one. So it's not a myth. There is definitely a link between gum disease and heart issues in men. Now we know.
Yeah, I mean, they've even when someone gets like a bypass and they take out a piece of your blood vessel in your heart, when you do DNA testing on that, they can't grow bacteria from there. But if they do DNA testing, they can match it up with the exact DNA of the bacteria in your gums, not someone else's gums. Yeah,
that's very scary.
Although they haven't shown that direct cause, I think it's just a matter of time personally before they'll say directly this bacteria goes from here into your blood vessels. It gets lodged there. It causes the inflammation. The cholesterol gets laid down. I've been doing a lot of studying and reading on this for my own personal health management, but I'm not a cardiologist. But there's a lot of information out there. It's very easy to read up on this, and it's not just me that's saying it. There's lots of studies.
And then stress, apparently stress can manifest in your jaw. I never knew this. How does it actually lead to cracked teeth?
Yeah, so it often shows up in the jaw before it shows up anywhere. Many men will clench and grind their teeth, especially during sleep or intense concentration, or when working out, the clenching and grinding. Clenching generates forces that far exceed normal chewing. And over time, these forces lead to cracks, little cracks in the enamel and in the dentine. And these cracks can progress into what we call cracked tooth syndrome, where a tooth hurts when you bite or release, and it looks normal on the surface. And the problem is cumulative. Every stressful day adds more load. Each night of grinding adds more damage. And eventually, a tooth that looks intact just fails structurally. It just splits open or gets a cracked tooth syndrome.
Sure.
And you sometimes have to get a crown or an onlay, a root canal, or even an extraction. And managing stress, protecting teeth with a bite plate. We've done quite a few podcasts about wearing bruxism or grinding plates. These need to be made properly by the dentist, and addressing these bite forces can prevent a whole cascade or a downhill slide of expensive and irreversible treatment. And this is a classic example of how lifestyle factors silently translate into dental costs later.
So now we know there's a link between gum disease and heart attacks in men. There's also apparently a surprising connection between gum disease and erectile dysfunction. Is that correct?
Yeah, so that's a topic many men find surprising, but the science is there. They've shown erectile dysfunction and periodontal disease share common mechanisms, particularly the vascular dysfunction and the systemic inflammation. And healthy erectile function depends on good blood flow, and chronic inflammation damages the blood vessels and it impairs endothelial function. And periodontal disease is a significant source of chronic inflammatory burden in the body. And there's a number of peer-reviewed studies, that means properly done studies, which have demonstrated an association between moderate to severe gum disease and erectile dysfunction, even after adjusting for other factors like smoking and diabetes. And, the important message here is not fear, but integration. Oral health is not just cosmetic. It's part of a network of systems that affect circulation, inflammation, and overall male health. And looking after your gums is one more way of looking after your vascular health.
Okay, and why are men at a higher risk for oral cancer, doctor? And what specific signs should they look out for?
So men are more likely to develop oral and oropharyngeal, meaning your throat cancer than women. This is mainly due to higher exposure to risk factors like tobacco use and alcohol consumption and delayed diagnosis. So especially hard alcohols like whiskey and rum and things like that, vodka, all the shots. Shots is never a good idea, no matter what anyone says. Uh, Nothing good happens after a whole bunch of shots.
Yeah.
Oral cancer often begins painlessly. Early signs include persistent ulcers, some red or white patches, some lumps, unexplained bleeding or numbness. You can get lesions or sores on the side of the tongue. They can look painful, but they sometimes are not painful. That's like if you got something on the one side of your tongue that looks like it should be really sore, but it doesn't hurt, that's not a good thing. Get it checked out. So the floor of the mouth, which means if you lift up your tongue, that part of the mouth that's underneath your tongue, and the very back of the throat, those are areas that are particularly concerning. Interestingly, is alcohol and together multiply the risk rather than adding to it. And one of the other things that's very important is HPV, or human papillomavirus, also plays a growing role in certain throat cancers. So that's actually a little bit off topic, but they've shown that the more partners that a person has in their life, the more chance they have of throat cancer caused by papillomavirus, because it's a sexually transmitted disease. We won't go into how you get it in your throat, but let's put it this way: that happens. And yeah, I know sometimes I crack jokes, but I don't want to go there this time. But I think I might have.
I know what you're going to say.
Yeah. So regular dental exams include cancer screening. There are a lot of men, now getting a bit worried. Catching cancer early dramatically improves survival rates and reduces the need for some hectic, aggressive surgery or even radiation. And ignoring early signs is one of the most dangerous delays men make in healthcare.
And now for the active guys, Doctor, how do contact sports and minor impacts lead to long-term dental costs for adult men?
Yeah, so dental trauma is not a once-off event. A chipped tooth at 25 can become a crown at 40, an implant at 60. Repeated minor impacts, even without obvious injury, can weaken enamel and dentine over time. Contact sports without a proper mouth protection, a professionally made mouth guard, can increase the risk of fractures and nerve damage and jaw joint injuries. And, from a financial perspective, the cost of a custom mouth guard, we now make them with a 3D scan. It's trivial compared to the lifetime cost of repairing or replacing damaged teeth. And, from a biological perspective, once tooth structure is lost, it can't be regenerated. I mean, we have technology now with 3D printing and molds and injection molding that we can come close, but it's still not your own tooth. And protection during sport is not about being tough or looking tough. It's about preserving natural teeth for life.
And then when it comes to common medications, let's say for high blood pressure, can this also negatively affect a man's oral health, Doctor? Yeah,
so in our podcast about saliva and medication, we spoke about blood pressure medication causing dry mouth, and saliva is essential for neutralizing acids and washing away food debris and also delivering minerals that protect your enamel. And dry mouth significantly increases the risk of cavities and gum disease, bad breath, and infections, and especially root decay in older males becomes more common when there's no saliva. That's where you've got a bit of recession and then your mouth is dry and you actually get a cavity in your root, which goes much quicker because the roots are softer. And often it goes undetected until it actually gets in the nerve. And men on long-term medication often think that their dental problems are due to aging, but it's actually to do with medications. And there's things you can do, such as what we discussed before, saliva substitutes, fluoride supplementation, dietary adjustments, and more frequent monitoring. And, medication saves lives, but its oral side effects must be managed proactively.
Okay, and then, sleep apnea that we've also discussed before in the podcast, it's more common in men. How exactly does sleep apnea ruin your teeth?
So, yeah, it's more common in men, particularly those that are overweight or have certain jaw or airway characteristics. As you said, we did a few podcasts on this. It affects your breathing during sleep, and it has far-reaching health consequences from a dental perspective. Sleep apnea is associated with mouth breathing, dry mouth, acid reflux, which we've done, how that affects your teeth, severe tooth wear, people that snore and have apneas, they grind a lot. The reflux acid erodes the enamel, and the grinding accelerates the damage. We do see a lot of this, especially in men. A lot of the men we treat with Invisalign and then injection molding, building up their bite. Some of them are only in their 40s or 50s. And men with untreated sleep apnea often present with cracked teeth, sensitivity, failing restorations or fillings that are falling out. And addressing airway issues can protect both general health and dental structures. And dentistry plays an important role in screening for sleep apnea and providing certain forms of treatment in collaboration with medical colleagues. And, one of those is a mandibular advancement device or splint, MAD or MAS, which we do at OPTISMILE. We make one from Germany called the OPTISLEEP. So that helps to keep your jaw forward when you're sleeping so you don't choke on your tongue. We have done entire podcasts on that as well.
And then, Doctor, do men really need to floss daily, or is it just a nice to have hygiene habit?
No, it's definitely far from optional, or shall I say, yes, you have to do it. Men have higher rates of gum disease. Plaque accumulation between the teeth is a major driver of gum inflammation. And, the biological logic is clear. If the plaque sits undisturbed between the teeth, you get inflammation, and over time there's bone loss and your teeth can get loose. And there are other ways to clean between your teeth. We've done some podcasts on that, and there's more coming up. And the cost of daily interdental cleaning is almost nothing, but the cost of treating advanced gum disease is expensive.
And then final question for today, Doctor. What is an executive checkup, and why should busy professionals prioritize it?
Look, we treat all of our patients like executives, including moms and everybody. But I like that name, executive dental checkup. It does appeal to the executives that are listening to this. And it's for people who value efficiency and long-term outcomes. We always focus on a comprehensive assessment right at the beginning, rather than like a piecemeal treatment, like a little bit here and there, where you come in every couple of years and you say, oh, this one fell out, or this one's broken, can you just check that? We include all detailed photos, x-rays, 3D scans, AI, x-ray, 3D x-rays, gum, we check your gums, risk, we check your risks, what other aspects there are that are causing higher risk for your particular situation. And then the goal is to understand where the problems are likely to develop, or just where pain exists today. And for busy professionals, this approach prevents emergencies, it protects productivity, and allows planned conservative treatment rather than crisis-driven dentistry. And in short, it respects time, it respects money, and it respects biology. And that makes it a rational health investment, not a luxury.
So, gentlemen, the message today is clear. Oral health is whole body health. If it's not clear now, then it will never be. So don't wait for the pain to start before you book that appointment, and don't be scared. Thank you, Dr. Yudelman.
Don't be scared.
Yeah.
No, don't be a wuss.
Yes,
don't
exactly. Thank you, Dr. Yudelman, once again, for shedding light on these silent risks. We appreciate it.
My pleasure, and thanks again for all your hard work and for your great questions, and looking forward to speaking to you next week.
Likewise, thank you. And for more tips on how to save your money and save your teeth, stay tuned for our next episode. Until then, take care.
Discover the world of dental excellence with OPTISMILE. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OPTISMILE or book directly online on optismile.co.za. OPTISMILE, where global expertise meets local care.